All right. Good morning, everybody. Welcome. My name is Alice Bufkin. I am the Associate Executive Director of Policy and Advocacy at Citizens Committee for Children. I want to thank you all so much for joining us in this series entitled Roadmap to an Equitable Recovery. During each part of the series, we are walking through data and findings from the new 2022 edition of CCC's Keeping Track of New York City's Children data book, highlighting challenges and opportunities for New York's families, as well as the impact of the COVID-19 pandemic on child and family well-being. In addition, we'll highlight key policy areas we can mobilize around to ensure the needs of New York's children and families are met so our communities can recover and thrive. Today, we will be discussing how we as a city can enhance behavioral supports for New York's children. However, we also hope you'll join us for parts 2 and 3 of the series. On June 2nd, we'll be discussing youth opportunities from services to justice. And on June 8th, we'll be discussing issues related to economic security for all New York families. If you aren't already registered, we'll be posting information on these upcoming webinars in the chat. For our conversation today, we are first going to hear from my colleague, Bijan Kimiagar, who's the Associate Executive Director for Research at CCC. Bijan led the team that developed our 2022 Keeping Track data book, which you should be able to find a link to in the chat as well. Bijan is going to walk us through some of the data specific to the emotional and mental well-being of New York's children. We're then going to have a panel that Bijan will moderate, where we'll discuss the data, the experience of New York children's families, New York's children and families, and some of the key policy areas that city leaders should prioritize to help support children's behavioral health. In addition to myself, we'll be hearing from Rosalia Watkins, Education Services Specialist at Vibrant Emotional Health, and Rohini Singh, Assistant Director of the School Justice Project at Advocates for Children. They are both incredible advocates. I'm really excited for the conversation we're going to have. And if we have time at the end, we'll have an opportunity to answer your questions. So if you have any questions, if you have any technical difficulties, feel free to put them in the chat and we'll get to them. And in addition, we are recording this webinar and this conversation, so we'll be able to share it out with you afterwards, as well as the slides that Bijan will be presenting on in a moment. So with that, I am going to go ahead and hand it over to my colleague Bijan to discuss keeping track and highlight some key considerations for children's behavioral health. So Bijan, I will hand it over to you.
Thank you so much, Alice. Good morning, everybody. It is a pleasure to be with you all today and to share with you the new Keeping Track of New York City's Children data book. We have a lot of information in it, and I'll be sharing with you some highlights specifically around children and young people's behavioral health. First, I want to give an overview of who are New York City's children, tell you a little bit about the components of the data book, and then get into those data. We know that New York City is home to more than 1.7 million children, and this represents the largest child population in the nation, including more than 500,000 children under the age of 5. The child population is incredibly diverse as well. 1 in 12 children was born outside of the United States. More than half of children have at least one immigrant parent, and nearly half of children live in households headed by a single parent, a grandparent, a foster parent, or another relative. The racial, ethnic, and linguistic diversity of the city is also apparent in the child population. And while we know this, that the diversity is great, we also see patterns of segregation that persist to a significant extent in neighborhoods, in schools, and in other settings in children's lives. And for this reason, we've produced the Keeping Track of New York City's Children data book and have over the last 4 decades to present the facts and shed light on progress and gaps in inequities stemming from structural discrimination, and to demonstrate the importance of public policy and budget decisions on the lives and well-being of New York City's children and families. The data that we analyze and report in the book come from dozens of government sources, including the US Census Bureau, as well as New York State and city agencies, either through public data portals or through our team's requests to agencies for unpublished data, including many city agencies that we work with on a daily basis. We also know that on this topic specific to child and adolescent behavioral health, that there is a dearth of information. And so our advocacy is not just about increasing services, but also increasing the availability of information to be able to monitor and support young people's behavioral health needs. The data book offers the most comprehensive account of the lives of New York City's children and families, both prior to and during the COVID-19 pandemic. And in each chapter, we highlight data to understand both where we've come from and where we are in order to inform where we want to go. The book provides demographic information about our city's children, as well as facts about their economic security, housing security, health and mental health, educational opportunities, and data specific to youth and the context of family and community. Whenever possible, we provide data at the community level, from zip codes to school districts, and offer geographic profiles for each of the city's 59 community districts, 5 boroughs, and New York City as a whole. What I'd like to do now is provide more information about the unprecedented loss and disruption to family services and stressors to well-being that families experienced during the pandemic, but also put in context that families experienced these stressors sometimes even before the pandemic started. Looking at the adult population for a moment, we see that the need for mental health services during the pandemic increased dramatically. We know nationally from national estimates that among the 18 and over population, the symptoms of anxiety and depression increased threefold. And locally in New York City, we see that the calls to the New York City Well mental health hotline went from about 64,000 calls prior to the pandemic to over 100,000 calls during the pandemic. Again, looking at a larger population of New York City households with children overall, we know that from data from the Household Pulse Survey, 1 in 2 households with children reported difficulty meeting their weekly expenses. 1 in 3 renter households with children reported being behind on rental payments. And 1 in 7 households with children reported sometimes or often not having enough to eat. These conditions affected young people's opportunities and challenges in profound ways. 1 in 10 households with children reported 0 days of live contact with teachers over an average week, and 1 in 2 youth ages 18 to 24 reported symptoms of anxiety and or depression. Perhaps most significantly and tragically, the pandemic resulted in widespread illness and loss of life, with a disproportionate rate of hospitalization and death among people of color. Through our own analysis, CCC's own analysis of census data and data from the New York City Department of Health, we estimate that around 4,730 children experienced the loss of a primary caregiver, and this includes biological parents or grandparents that are the primary caregiver or other relative that are the primary caregiver in the household with children. Children's behavioral health needs we know were already in short supply prior to the pandemic, and advocates, including CCC, have been working in coalitions to increase investments before and especially during the pandemic to support children who have experienced profound loss. We want to put these data, though, in the context of what was happening prior to the pandemic. We were already concerned about the growing mental health crisis among young people. We know from data that high school age youth were increasingly reporting symptoms of depression, particularly among female youth and lesbian, gay, or bisexual youth. Again, data from prior to the pandemic show approximately 10,000 high school students reporting having experienced physical or sexual dating violence in 2019, a decrease from prior years. But estimates of physical and sexual violence are higher among youth identifying as gay, lesbian, or bisexual. And we also know from national data on trans and non-binary youth that also point to alarming rates of similar experiences. Also looking again at data prior to the pandemic, we know that fewer 10 to 24-year-olds in New York City suffered premature deaths in 2019 compared to earlier years. And this is in part due to fewer homicides. Still, more than a quarter of Black youth deaths were from homicides, and suicides increased 30% among 10 to 24-year-olds. And on this slide are the data disaggregated by race and ethnicity, where we see differences in the leading cause of death among this age group. So again, there is mixed progress and setbacks when we're looking at information during the pandemic and prior to the pandemic. A sign of welcome progress over the last 2 decades has been that teen alcohol and cigarette use fell precipitously. In recent years, a growing share of middle school and high school students, however, have reported higher e-cigarette or vape use. And reported use of marijuana has stayed consistently around 18%. Also in recent years, we see data from both prior to the pandemic and during the pandemic that New York City students experience increased discipline from the New York Police Department safety agents. And this was really until the pandemic disrupted in-person learning when there was less contact with students directly on a day-to-day basis. We see that 2/3 of NYPD interventions came in response to students in emotional distress or to address minimal offenses that led to school mitigation. So in sharing these examples of progress and setbacks, we are telling a story of how to build a more resilient city. And the concept of resilience acknowledges the scars of trauma and reminders of what we've been through, and that we are in fact a new version of ourselves. And the new version that CCC sees as a vision for the future is one that invests in families as a key strategy to continue weathering the current crisis and prepare for others in the future. And our latest report adds to the roadmap of an equitable recovery by employing a strength-based approach to counter the risk-based and deficit-focused narratives that the data too often show. So part of this approach relies on mapping community resources that are important. And we do this by drawing attention to key community infrastructure, such as banks, grocery stores, and the example on this slide is of healthcare facilities. And this allows us to uncover where in the city there exists a network of supports for families, as well as where greater investments are needed. I'm just leaving the slide up for a moment so folks can see the different community resources that we map. And one major innovation in this year's data book is to our geographic profiles, where we now, in addition to the granular look of quantitative data that we provide in the tables, we have added an asset map to each of the geographic profiles to be able to, again, tell the story of where community resources exist and where they might need to be in greater supply. So now that we've had an opportunity to review some of the data in the Keeping Track of New York City's Children data book, it is my pleasure to introduce our panel of advocates who are going to have a conversation on the behavioral health needs of New York City's children and the steps city and state leaders can take to support them. Our first panelist is Alice Bufkin, Associate Executive Director for Policy and Advocacy at CCC. And we're also joined by Rosalia Watkins, Education Services Specialist at Vibrant Emotional Health, and Rohini Singh, Assistant Director of the School Justice Project at Advocates for Children. We will put more details about our panelists in the bio, their bios in the chat, I should say. And so I would like to start to kick off our conversation by giving everyone an opportunity to react to some of the data that I just presented. And Rosalia, I'd like to start with you. Can you talk about how these data resonate with what you're seeing in terms of the emotional and mental health challenges that students are experiencing in New York?
Thank you so much. First of all, I want to thank you very much for having us today. As many of you know, Vibrant Emotional Health is the home of the Mental Health Association of New York City, and we're really glad to be a part of this conversation. I also want to thank the Citizens Committee for your work in gathering this data, which has informed us for decades. But in doing so, I think you've also created a prototype that serves the country well. So thank you so much for all of that. Yes, the data that you've presented is, particularly that you've just outlined, is not only helpful and relevant, but starkly paints a picture of what our students and families are facing. Obviously, death of a caregiver would be the paramount thing that we are encountering, but also there is this pervasive fear of everything. It's hard to really put your hands on, because some of our children already had anxiety and depression and serious emotional dysregulation and other situations affecting their emotions, their behaviors, and their mental stability. But the COVID layer has added in just this other dimension to our work. Also, I want to point out caregiver strain, particularly for our parents that, a lot of our parents who are essential workers, their children and their youth had to deal with that extra layer of fear about their children being exposed, as well as the family dynamics shifting when parents are under such strain during COVID, and even now after, I shouldn't say after, right? But even now in this stage of our COVID experience, isolation, many of our students have not really recovered from the isolation they experienced. And I should also note that even though we have students that are going back to school now, we still have students that are not. We have students with medical conditions, students with medical conditions associated with their fear or their mental health needs. But it's just an important concept to understand that even though we have so many students returning to school, we have so many students that are still not in school and not receiving any kind of adequate instruction. Then there's the food and housing insecurities that you mentioned in your report. And certainly we're seeing that in our families that we serve, because it's not just a matter of, going to pick up a meal in school. It's not knowing where the next meal is coming from. And even though we may hear of all kinds of supports and benefits, we're all painfully aware that the COVID waterfall of funding and support is actually closing to drips by now. Then the last thing I think is important to mention is that we also, we all know about disparities in support from schools. We all know about missed instruction. But I think we also have to be mindful of the experiences of families that are involved with systems such as immigration, such as foster care, such as child welfare, such as criminal justice. And that also adds another dimension that we are seeing that's affecting many of our children, youth, and families. So when you look at all of this, we used to talk about ACEs, 1, 2, 3, adverse childhood experiences. What is this now? Now we have like a triplex of ACEs. Plus, you have to add to that social and racial injustices. And when you put all of that together, we're in a situation where students are experiencing compounded traumas, that are manifesting differently in each child. So thank you for a moment for me to share what we are seeing in a lot of our children, youth, and families.
Thank you for painting such a complex picture, holistic view of how we should be thinking about this from the student's perspective, but also from the whole family perspective. Rohini, if we could go to you, we have data around NYPD getting involved with students experiencing emotional distress. Based on your experience with the School Justice Project and other experiences, can you speak more to this connection between disciplinary practices, police involvement, and young people's mental well-being?
Sure, of course. And just to echo what Rosalia said, thank you so much for presenting this data, for collecting this data. The data really truly drives a lot of our advocacy efforts, and we really couldn't do a lot of the advocacy we do without having all of this laid out in the way that you just did. And so I guess just for background, Advocates for Children, we've worked for over 50 years now to ensure a high quality education for New York students who face barriers to academic success. And we really try to work with students whose needs are often overlooked. So a lot of the students that experience a lot of the things that Rosalia just covered, students with disabilities, students with mental health needs, the students that are involved in the juvenile criminal justice system, students from immigrant families, and students who are homeless or in foster care. And on the School Justice Project at Advocates for Children, we work with students who often have unmet behavioral and mental health needs. And instead of receiving support, they're met with and subjected to police intervention, exclusionary school discipline, and school pushout. And for us, just to add another layer onto the data that you all presented on police interventions, what's really alarming to us and should be to much of the city are the stark racial disparities that exist when it comes to police interventions in schools. And we know that this mirrors broader trends in policing in communities. But AFC released a report in June 2021 looking at the data that you all broke down a bit on police interventions, specifically child in crisis interventions. And so this is when a police or a school safety officer intervenes in an incident when a student is in emotional distress, and the student is then sent to a hospital for a psychological evaluation. And of these students, I believe 47% were Black, despite Black students only accounting for 25% of the total New York City public school population. And in addition, during these transports, some students as young as 5 were handcuffed. And so this is really alarming and really concerning data. And we see this in our casework. When a student is struggling emotionally, behaviorally, schools often don't have the resources, don't have the necessary supports to intervene and to provide that they don't have the appropriate lens to approach that student and that and their behavior. And so often they'll use the resources that they have, which unfortunately is often a call to 911. And so I think the impact on students is, and on mental well-being, I think the connection hopefully should be obvious. There's significant trauma involved in a police intervention on a child in a school setting. And I think the data, really emphasizes both that this is happening and then also that it's happening disproportionately in certain communities.
Thank you so much, Rohini. I really appreciate the added texture that you've provided here. And I just want to say that personally, and I know our colleagues at CCC look to Advocates for Children's reports for data, and I'm so glad that we have you all as a peer organization doing this complementary work. Alice, if we could turn to you, is there anything else you'd like to add about the data landscape to this conversation?
Yeah, thank you, Bijan. I think one thing that we at CCC have talked about quite a bit is some of the challenges in what data is available. What we have is often pulled together from sources that maybe only look at the city level data that really don't allow us to dig into at a real granular and geographic level, what is happening with kids on the ground? Where are they getting services? Where are they not getting services? And so often we have to use, certain national surveys as proxies rather than being able to really pinpoint, where do we need to be supporting kids more? So I just want to flag that as one of the challenges that I know that we are always looking at and really wanting to find ways where we can identify where the needs are. And that's also why we rely a lot on partners and anecdotal conversations to understand, what is it like for families and kids on the ground, especially now. But I also think in terms of what you said, I think it really tracks with what CCC is hearing from our partners across the state. We know, as Rosalia and Rohini both pointed out, kids facing more and more mental health challenges, more and more young people in mental health crisis. We were just speaking to some partners in Westchester, some caregivers and behavioral health providers. The kinds of issues that we used to see show up in children in high school or in college are showing up at younger and younger ages. We are hearing from many school-based providers are seeing record numbers of suicide assessments. And at the city level, we know that we're seeing more and more kids showing up in ERs and in hospitals with a higher level of need. And a lot of that was driven during the peak of COVID, because even as children are experiencing these very high levels of need, the access to services was going down at the same time for very obvious reasons. And the end result was kids weren't getting the preventive care that they need to really prevent the escalation of needs all the way up to that ER and that hospitalization space. We really want to be getting kids access to care as early as possible, including in school settings, including in communities. I think we're really seeing the need for a continuum. The fact that we have kids who are younger, who need sort of a universal lighter touch, all the way up to children who are experiencing more complex needs. And we hear from the media, we hear about this crisis all the time, but I think I know we'll talk about this later in the conversation, but I think we're really struggling to see the matching response to it. The one other thing I want to emphasize is something that Rosalia referenced, and that's, the data, Bijan, that you raised, looking at the challenges that families are having meeting weekly expenses, the 1 in 3 households who are behind on rental payment, food insecurity, disconnection from school. These are all stressors that at their root are contributing to mental health challenges that children are facing. They're part of why we need more behavioral health supports. We also need to tackle those issues themselves. We need to tackle the social and community needs that are exacerbating these challenges for children. So, we need to look at things like the housing crisis, supportive housing vouchers, access to supportive housing, understaffing in housing agencies. We need to invest in universal childcare, especially when we know that the lack of childcare is a big part of what's driving the disproportionate number of women, and particularly women of color, who are out of the workforce, have been pushed out of the workforce, particularly during COVID. We need to invest in income supports, anti-hunger programs. I think it's just really important to emphasize that part of the reason we include that data on general well-being is to stress the fact that this is all part of a child's life, a community's life. We often view them split up, but these are all connected issues, and we really want to push our state leaders and our city leaders to be investing across this continuum. So I will pause there and turn it back to you, Bijan.
Thanks, Alice. And your comments are really making just clear this point that even though there's a dearth of behavioral health data on children and adolescents and their families and even adults, that all of these other data points contribute to our understanding of the context that families are facing still today. And even more to the point, why we need to invest in families as a key strategy for recovery from the pandemic. And so I'd like to talk about this and ask each of you the same question. As we think about what children need in order to recover and thrive, can you describe what it would look like for young people to get the behavioral health supports that they deserve? Alice, can we actually start with you and then actually go in reverse order, Rohini and then Rosalia?
Sure. I think that this sort of continues on what I was saying before, which is the importance to think about children's needs along a continuum. So, we knew that we need universal support. So supports in schools and communities that are there for all kids so that they know where to go when they're experiencing challenges. They're surrounded by adults who know how to support them, whether that's in a school setting, whether that's in a community setting. But we also know we need sort of that higher end services, clinical care for more serious mental health issues, outpatient services, crisis services. We know it's abundantly clear that throughout the state, we just don't have enough child psychiatrists. We don't have enough clinicians that serve children. We have huge turnover rates. We have wait lists. Some of this is driven by state issues like Medicaid and commercial insurance reimbursement, but there are also a lot of steps that the city can take to address these issues. And I know we'll be, talking about that a little later in this conversation. I think Rosalia will speak on this some as well, but, these providers shouldn't exist in a vacuum. We need to be communicating, coordinating between different agencies, whether we're talking about supports in schools. If a child is receiving services in a school, are they also communicating with where their community behavioral health provider might be? Is there a relationship there? When we are talking about, a lot of the compensation models that we have for children's behavioral health are really not designed for how children actually live their lives. So things like Medicaid and commercial insurance are often reimbursing for a child who has a diagnosis. And we know that a lot of children don't have a diagnosis either because there's issues around stigma. We also know that we don't have enough diagnosing professionals. There's a lot of reasons why a child might walk in needing services and not yet have a diagnosis. And the fact that we can't reimburse for that creates real challenges for actually getting preventive services to kids. We also know that a lot of these models only pay for services for the child, not necessarily for the whole family, not necessarily for sort of the wraparound supports, whether that's community supports, resources, whether that's trainings for teachers. And that's how children and young people live their lives. They are part of families, they're part of communities, they're part of schools. And so the fact that the way we actually support a workforce to support children is really just based on this very narrow sort of definition of what mental well-being is for a child, and not really in touch with what their lives are and how complex their lives are, how interconnected they are with their families and their communities. And again, I think that's where we can really see the flexibility of city funding being very important, because we can come in where we don't have these same restrictions at the state and the federal level, and really provide some of those wraparound supports, be very flexible, targeted to communities. What does X community need specifically? And how can we come in and identify and listen to the community members and what they need and provide those particular supports? And then finally, I just want to say something that, along those lines, I think it's important to have a strengths-based approach to what community supports help keep kids just mentally well generally. So things like after-school programming, summer camps, youth employment programs, parks, all the things that, again, help just young people be well, help them feel supported. These are also part of the picture and really need to be seen in conjunction with the conversation around kind of how do we focus on the continuum of behavioral health supports as well. So I'll turn it back to you, Bijan, after that.
Thanks, Alice. Rohini, please feel welcome to contribute.
Sure. And I can't speak to the question is so broad, and I'm trying to envision, what it would look like for children to get the support that they need. Just to focus in on, the work that we do at Advocates for Children, and really thinking about schools and school environments and what they could look like and should look like. I think it's clear, that schools really need key resources to transform their environments and change the way that they approach students and student behavior. This was a need that existed before the pandemic, and I think has, been pushed into the forefront because of, a lot of the data that you went over in light of the pandemic. We know from national data that students are much more likely to seek support for mental health issues at a school than they necessarily would in a community-based clinic. And so it is really important that our schools are sites of healing, are sites where students can receive support. And just in general, it's also really important because schools are meant to be places not just where students learn academically, but also where they learn social emotional skills to help them throughout their life. And just in general, unmet social, emotional, and mental health needs and behavioral health needs, they can have a significant impact on learning. That's something that we see in our work every day. Most of my clients are students that are experiencing significant behavioral or mental health challenges. And instead of receiving support, as I mentioned before, they're being met with a police intervention, exclusionary discipline, and which really obviously impacts their ability to engage in school. And so, unfortunately, what we've seen so far in New York City, while there have been some attempts at promising programs, attempts at taking a look at this issue, a lot of the support that has been offered has been, fragmented and is not really addressing, as Alice had mentioned, the continuum of needs that exist for students. And so, even though in the last few years, the city has hired, new social workers, and new counselors, and has been putting an emphasis on social emotional supports. Some of these initiatives, they're not addressing the immediate needs of school communities, and are somewhat piecemeal. And so what we would love to see is really more of a comprehensive system to ensure that students are both receiving direct mental health services, in schools, or referrals to community-based mental health providers, so that they can receive direct mental health services. And then also that schools are receiving support so they can effectively manage student behavior and mental health. I can't count the number of times I've been in a school meeting where it's very clear that, school staff are not aware that, all people, all students, their behavior, it's happening for a reason. And there's every behavior has a consequence. There's always a function behind behavior. And so, we really need to approach behavior the way we would approach a student that has a learning disability, or a student that, has a specific academic need. We need to approach it with intervention and not, punishment and exclusion.
Thank you for that perspective of more support, not more discipline, to address these social emotional needs. Rosalia, from your perspective, what would it look like for young people to get the behavioral supports that they need? If you can unmute yourself, please.
There we go. So first of all, thank you for this opportunity to dream. And I hope that this conversation will allow seeds to be planted in all of our communities so that some of these can actually come true. For Vibrant, we work directly with families, students, and youth through a structure of family and youth peer advocates. And as well as working with adolescents in our high school equivalency program. And I think when you look around the city and you look at the needs right now, we need support for students wherever they are and whenever they need it, in every aspect of their lives, not just in school and not just in the community, but actually both. And, and sometimes there are conflicts with billing structures that may prevent this, but this is not a time to allow system barriers, fiscal system barriers, to prevent us from really meeting the needs of students that really go beyond so many different program structures. I can't have this conversation without talking about languages. So if you really believe in the family structure, and if you really believe that every family should have access to mental health care, treatment, and supports, you cannot do that without languages. Also, you cannot do that without offering services at different times of the day, different days of the week. So, when you ask some of the things that I'm particularly looking forward to achieving, these are some. Similarly, I thank you for mentioning, Alice, the need for psychiatrists. We need loan forgiveness so that we can have more psychiatrists. And I think that I have a lot to say about healing-centered schools, but I just want to look at the individual needs for this particular moment and talk about healing-centered schools later. But I think that we have to look at continuity of care differently. Okay, so continuity of care now, we're seeing and hearing from early intervention programs that we have young children, babies, okay, that really need emotional health supports. And at Vibrant, we're starting to work with parents prenatally, as well as parents that have just given birth, to provide mental health supports, because living through COVID while pregnant is a whole different, or living through COVID as it progresses even, is a whole different type of experience. Those of us who've carried children, we know what stress feels like at that time. Similarly, in terms of continuity of care, we must do something to bridge the programs for youth. We all know that adolescent goes beyond 18. We know this. So why is it that our programs, our mental health programs, and this may be a statutory requirement, but why is it that these programs stop at 18 and then the youth have to go into the adult system that does not fit them at all? And then we wonder why that system is not working and why youth don't adhere and find comfort in that system to provide their mental health needs. Finally, I will talk about the glue. And I consider family support to be the glue in all of this. How we support families in helping their children to know about treatment, to know about options, to fight against stigma. You know, I don't want to minimize the significance of the importance of family. And I keep saying lastly, but I promise it's my last component. I think we have to change how we define and support mental health crisis. Now, we're on the eve of launching 988, as many of you know. But it's not just this broader network. To be able to call 988 to get crisis support is so important. But what does that mean in a school? What does that mean in a community? How do we define a mental health crisis in a school? And I know Rohini is going to talk about this in a little bit, but we say if a person is a danger to themselves or someone else, that's a mental health crisis. And is that enough? You know, is that still an adequate, is that still a clear, adequate description of a mental health crisis in all situations and all circumstances? It may have to be reworked, and we can, obviously, that is our mission. We want to pay attention to when a person is a danger to themselves and to others. But understanding what that means in a school, understanding what that means in a shelter, understanding what that means in the different environments where our children, youth, and family lives becomes crucial.
Thank you for that, Rosalia. And I think that when we ask this question about the vision, sometimes we think about complete transformations, and what you shared are really some fundamental things that language on its own is something that spoke to me. Thank you for sharing that perspective. So let's turn a little bit to some nuts and bolts about one reason why we're here today is to inform the city budget process, which is currently underway. The mayor released his executive budget on April 26th, and the city council released their response to the preliminary budget earlier in April. We all know this because we're following CCC's e-action network and newsletters. And if you are not yet signed up, we can put a link to that in the chat so that you can get our responses to these responses as well. Continuing the conversation about what children and families need. Rohini, we're going to start with you. And if you could speak to the funding that the mayor or the city council is proposing that you think would help support children's behavioral health needs. And more importantly, where are these proposals falling short? Where should our city be putting its funding in order to address children's behavioral health needs and this crisis that the data and all of your experiences speaking to families and children's experiences really are making clear?
So I'll focus again on schools, since that's really the emphasis of Advocates for Children and where our expertise lies. I mean, to be honest, the proposed budget contains very little funding when it comes to mental health and social emotional supports in schools. It's alarming, and it's alarming given that there has been a lot of talk about the need and a lot of talk about the youth mental health crisis, and certainly the administration has emphasized that, but we have seen very little targeted funding to address the needs of students in schools, and so Advocates for Children and a number of different organizations in the community have been pushing for a number of different initiatives to try to address some of this need. First, I want to shift a little and focus about restorative practices and restorative justice practices, which I know is I think Rosalia might touch upon this a little bit as well. But when we're talking about just in general, like the continuum of services, I think one of the initial first steps is really to make sure that schools are approaching student behavior in appropriate ways. And in 2019, the city made a commitment to bring restorative justice to all New York City schools. But unfortunately, that was essentially an unfunded commitment. And so, we would really want to see citywide expansion and implementation of school-wide restorative justice practices. And this is, just, I guess, to back up a little bit, restorative justice, it's all about building and healing relationships and addressing the root causes of behavior, holding students accountable, and essentially teaching positive behaviors. And they've been proven to work both in New York City schools and around the country. What we hope is that, every school has a restorative justice coordinator, and, all school staff are trained, and also members of the school communities are trained. And this includes, not just people that work in the schools, but parents, community members. I feel like Rosalia was touching upon this a little bit in her comments before. This is not, we want these resources to be available to students wherever they are. And we want schools to really be embedded within the communities that they are in. And so because of that, what we're pushing for is, an investment of, it sounds like a lot of money, but it is a drop in the bucket when it comes to, when you think about what the NYPD's budgeted or other city agencies' budgets are, investing $118 million in fiscal year 2023 to bring restorative justice practices citywide in every school, so that every school approaches student behavior in a way that is not punitive, that actually addresses the underlying reasons of that a student is acting the way that they are. And then in addition to that, again, as we talk about this need for a continuum of services, we really want to see that, students that have the most significant needs are getting the support that they need. And last year, the City Council funded a new model, a promising model for integrating a range of direct services called the Mental Health Continuum. And they funded it for $5 million. But unfortunately, they only allocated that money for this current fiscal year. And in order for the program to be launched and to continue, it needs to be baselined in our city budget. And again, $5 million in comparison to the different initiatives that exist is really just a drop in the bucket. And the mental health continuum, it's a really innovative model where what it does is it leverages resources across agencies. And so it involves creating partnerships between schools and hospital-based mental health clinics, so that the Department of Education, Health and Hospitals, and then the Department of Health and Mental Hygiene, DOHMH, can provide more effective and efficient supports to students that have significant mental health needs in schools. And this type of support, we believe will address a lot of the issues related to some of the data that we went over when for NYPD interventions for children in crisis, because schools will have, they'll have places to call. Like there will be a dedicated specialist at part of NYC Well who will respond to calls from these schools to ensure that, if a student is in crisis, they know how to navigate that situation and know whether or not it is a situation where that actually requires a call to EMS, or it might be a situation that can be de-escalated within a school. And then students that are, repeatedly in crisis will then have a direct referral pathway to a health and hospitals clinic. And so this type of interagency collaboration, has never really been done before in the DOE. And we're hoping that this $5 million will at least, if it could be baselined in the budget, will at least bring this program to 50 schools in some high needs areas in the city.
Thank you so much for that. I really appreciate how you put the relative context of some of what's being asked for is so, can be done with the money that we have, especially when we think about the larger budget context, and really looking forward to these innovations being integrated in a more permanent way. Rosalia, if we could hear from you, what are your thoughts on the budget conversation?
Well, I have to start with an apology. I don't know much about the budget, so forgive me if I just come up with my Christmas list of where I think we need money and where that money should go.
You're forgiven.
Thank you so much. I'm in the wonderful weeds of direct service provision where we can, because we are with the families and youth, because we are in the schools, we can see where we wish we had money to influence. So having said that, I think that one of the most important things about that I think needs to be looked at is when we look at schools in particular. I think it's not only do I want to say yes, we need healing-centered schools, and for those of you who may not know, healing-centered schools is a movement that allows the entire school community, administrators, parents, youth, teachers, everybody to come together and to assess what are their mental health needs, what mental health practices do they need to develop or maintain to keep their environment and everyone in that environment healed and prepared for learning, right? It's hard to learn when you're not in a healing, supportive environment. So that when we think about what's needed for that, one of the things that very often goes under the radar is that we need funding to support youth and parent voice. We have a lot of brilliant youth. I mean, sometimes if you go to a PEP meeting, you can hear these youth coming up with solutions for the chancellor on how to address this and that. They're in schools, they have solutions, they have energy. And I think that it is instead of funding deficit models, it's really important for us to figure out a way to support youth and parent voice. You know, I can't agree more with what Rahimi says about restorative justice. It does need more support. But I think the item that is just really interesting to me, another component of healing-centered schools is not only youth voice and parent voice and assessing what the school needs and developing plans. And obviously that would require professional development to all parties. But there are other things like students having access to sports. Not all students have access to sports. Students having access to art, to music. Not all and now, you know, during COVID, everybody was like paint, art, music, you know, art therapy, you know, but in many of our schools, something as basic as that does not exist. And here's, I think, my most important ask. I think that we need to fiscally support the infrastructure that's needed in schools to support a healthy school community. What do I mean by that? Well, where's the room if you need to go someplace to cope? Is that room on the 5th floor? Is it designated? Or is somebody just pulling up a chair and finding a corner for you to sit as a student and get yourself together? What are we doing to fiscally support coping mechanisms and services? Restorative justice, where does that happen? What room? Is it in the auditorium? Is the auditorium always available? Let's not forget, restorative justice is an important process when we talk about suspension policies and suspension practices. But where do these things happen in a school building? Where is the assigned room? Even in terms of thinking about the continuum, if you're going to make arrangements for a telehealth visit in the school, where is that going to happen in the school building? Where is the room? So obviously, when you're thinking about these kinds of mental health needs, you have to not only think about fiscally supporting them, you have to redo how you think about building utilization.
Thank you for that, Rosalia. Alice, I always look to you for your advice on how we should be thinking about the city and the state budget, but today we're talking about the city budget. What are your thoughts on the city budget right now? And since we're coming to the top of the hour, if there are any final thoughts that you want to add, and Ruzelia and Rohini will go to you after Alice for some final thoughts too before closing out today's conversation. Alice, please enlighten me and all of us.
I mean, I think Rohini and Rosalia have hit on so many important elements of sort of what our city needs to be doing, both in terms of some of the specifics, but also sort of a broader vision of what we as a city should be doing. Just in the time we have, I'll reference a couple of other areas. We talked about the need for the continuum in terms of also having supports for students who have higher level of needs, who may need clinical services. And so, we do have the model of school-based mental health clinics, which essentially provide sort of an on-site clinic to provide supports for students and provide clinical care, but they come with a lot of challenges. And some of those challenges I sort of referenced before is, in order to be reimbursed, you need a diagnosis. The focus is really on the child. There's not as much opportunity to do what really is needed to integrate those types of services into a school. So it's not just renting space in a school. It's actually part of a true continuum where everyone has buy-in, everyone has ideally healing centered models or a movement, as Rosalia said, and that's just part of the resources there available for children. But the way it's set up makes that very challenging. And we also know that for children, for instance, who don't have insurance, the clinics don't get reimbursed for that. So that's where we really have joined, with other advocates in the city of really pushing. That's where the city can come in. That's an important, critical role the city can come in to provide that wraparound funding to say, how do we make this effective? We will provide funding for things like whole school trainings for integrating these supports into schools. We'll provide funding to make sure that kids who don't have a diagnosis or don't have insurance also get the care that they need. And so, we're really supportive of additional funding, not only to increase school-based mental health clinics, but the number of them, but to make sure that those that exist are the best version that they can be and that they are actually part of the school community, not sort of out there independently. And that, again, is, I think sometimes the city gets a sense of like, oh, that's a state or federal issue. There's so much we can do because we are not the state or the federal government, because we have that flexibility with how our funding comes in. The other thing I'll mention briefly is there's some really essential city council mental health initiatives that we want to make sure get maintained. Things like Children Under 5, which provides screening and clinical evaluation for young children, court involved youth, which works with young people who've been justice involved. Those are important initiatives. And then we also think about broadly our providers who contract with the city. So we have a deeply underpaid workforce, and so there's a lot of push for cost of living adjustments and for sort of more equitable pay and benefits for our human services workforce, which is really the backbone of our community-based organizations and a lot of the work that's provided. But just as a final thought, I want to just say that, those are some of the specifics. I think Rosalia in particular makes the point that, we can focus on what's in the city budget. And that to me is a first step and a bare minimum, because we have so much work to do and so much power, whether it's from youth, from advocates, to say this is what our children deserve and families need and what we should be doing. And so, I think we should really view this as, again, a bare minimum, a first step, but part of a broader vision to try to envision what we think we want our city to look like and to actually address the crisis that keeps being raised and say, what does it take? So I'll just pause there and turn it back to you, Bijan, because I know we want to hear a few final words from Rohini and Rosalia.
Yeah, thank you, Alice. Rosalia, if you can share some final thoughts and Rohini
Yes.
after.
Certainly, all hands on deck, wherever you are. We all have to unite, and everyone has to be involved in a lot of at least two issues that we're talking about today. It's all hands on deck because we're still losing a lot of children and youth to suicide. So beyond COVID, we really have to come together, all of us, all hands on deck.
Thank you, Rosalia, for that message. Rohini.
Yeah, I don't think I have anything else to add besides that. This is, it is a crisis. It is something that, needs to be addressed immediately. And I'm hoping that this administration and the city council can really take a look at this and provide more investments towards it as an initial step.
Thank you so much, Rohini. And thank you, Rosalia and Alice. I have learned a lot from this conversation today. And I feel like even though I'm steeped in it, there's always more to be learning from each of you and our colleagues. Alice, I'm going to send it back to you to close us out for the hour today in the conversation we had. And I will put the slides back up for you.
Thanks. I just want to thank everyone for joining us. I know we're a couple of minutes over, so really appreciate those who are still on. I want to thank you, Bijan, for moderating. Thank you, Rosalia and Rohini. I learn from you guys every day. I'm really proud and honored to be here and work with you guys generally. So we'll be following up with everyone with slides as well as the recording from this presentation. And I know that you can see in the chat, we've been posting it, but as I said, we will be having 2 additional webinars in the series, one on June 2nd and one on June 8th, one related to youth opportunities and one related to economic security. So we hope you can join us for those. We hope you'll check out our Keeping Track data book. Again, hope you'll be part of the conversation and thank you for the work you're doing. And, to Rohini and Rosalia's point, let's all hands on deck. And we look forward to continuing to work with everyone to push for these issues and support kids in our communities. So thank you so much.